Hello, my name is Thelma thein, and I would like to discuss the health and humanitarian crisis in Myanmar from the standpoint of a dietitian nutritionist and a lactation consultant. Preceded by the economic downturn prior to COVID and the disastrous effects of COVID itself, the tragic military coup d'etat and the total breakdown of the health system, a perfect storm for a catastrophic humanitarian health and refugee crisis has been created. Myanmar is described as the least developed vulnerable country with 13 million people living in poverty prior to COVID. The United Nations Development Bank now reports that another 12 million people will be pushed into poverty by early 2022, which is about half of Myanmar's population. For those in poverty, there are no safety nets, no food banks, no stimulus checks, or unemployment benefits. COVID-19 caused the loss of millions of jobs, 75% in rural families and 84% in urban families. Therefore, indebtedness increased, and especially for farmers who were hard hit, and they had less money for supplies and seed, so less food was produced in 2020. With the military tightening transportation and distribution, food prices have rocketed. Government hospitals and clinics provide 80% of healthcare. Because healthcare workers joined CDM, the civil disobedience movement, hospitals are now barely functioning with skeletal staffing. People are afraid to seek medical care because military soldiers attack hospitals and clinics. Thus, those with chronic diseases such as diabetes, heart disease, renal disease, cancer, HIV, and tuberculosis cannot receive the needed treatment. Women and children are also receiving suboptimal health care, therefore increasing maternal infant, child mortality and morbidity rates. Preventive programs for anemia, vitamin A, B, iodine deficiency diseases have all been halted. Deficiencies in pregnancy and childhood can cause irreparable brain damage and cause malnutrition. Because of COVID, millions of children did not get needed immunizations last year. And right now, the country is running out of vaccines. Lastly, Myanmar has one of the highest rates of infant mortality, 50 deaths per 1,000 live births, while it is 5.7 deaths in 1,000 in the US. Myanmar also has high rates of babies born prematurely, low birth weight, ill, and with disabilities. One child out of 20 in Myanmar does not reach the age of 5. These numbers will be higher now with current food shortages and inadequate health care. So according to the UNICEF, adequate maternal and child health care and nutrition are the foundations of child survival needed for national development and prosperity. A nation's people must be fed adequately for optimal productivity and development. Not only have the military leaders violated human rights and the right to food, their actions are leading the people into famine, disease, and displacement, and causing people to live lives of desperation with no hope of a good future. The military has also reached out to destroy the health, nutrition, and every aspect of life of future generations. We just can't let the military continue their cruel and inhumane ways. So at this time, I ask that each of you keep the country and the people of Myanmar in your prayers. Thank you.